Gum disease. 75% of the people, 3 out of 4 people have gum disease. I'm Dr. David Shannon, and I see gum disease all day long. I'm in Northridge, California. I have a dental practice, a general family practice, and some of the things that I see I want to present to you so you understand what's going on with gum disease. Gum disease is something that sneaks up on you. It's usually, actually it's always painless until the very end stages of it. One of the reasons why you should go to the dentist and get your teeth cleaned every 6 months is to prevent gum disease. And besides preventing it, it gives us an opportunity to see your mouth, and maybe we have to diagnose it, because maybe you haven't been to the dentist in 5 or 6 years. If you haven't, you've probably got some form of gum disease. It starts off with the very famous, as you've probably heard, gingivitis. Very fancy word, gingivitis. All that means is your gums are puffy, and when you brush or you floss, your gums bleed. Dr. Shannon, I don't want to floss my teeth. Every time I floss, I do it wrong and it makes my gums bleed. No, your gums are bleeding because you have gingivitis, not because you're not flossing right. You have the beginning of gum disease. And in the beginning, the gums get puffy. Why are they puffy? Because food, bacteria, bugs, are getting in between your teeth under the gum, and they're sitting there and they're growing. And they're growing like rust, day and night, 24/7. Bacteria grows in your mouth. And it's bad because eventually it starts to eat the bone. What happens is the bone doesn't want to be there, and the bone starts softening up, and the bone starts getting cruddy, and it just gets worse and worse. Now you've got a bigger gap under your gums. Food's going to get down further under your gums. Bacteria are going to live further under your gums, and this goes on, and the cycle goes on, and the gum gets worse, and the gum gets, it's like these bacteria become like flesh eaters. I mean, it's not the official flesh-eating bacteria you can get if you go to the hospital and have a bad disease problem or something, but it is a flesh-eating disease that needs to be stopped. And you need to take that time and put your foot down and say, no more gum disease in this mouth. And there are ways to treat it. So once you acknowledge the fact that you have bad breath, that you have bleeding gums, that your gums, when you put your finger in your mouth or you put your toothbrush against your teeth, your gums pull away from the side of your tooth. That's not a good thing. They should be pink and tight and hold really well around your teeth. So once you acknowledge the problem and you see something's going on, call me. Call me up. Say to the girls in the front that answer the phone, I want to see Dr. Shannon because I think I have gum disease. You don't have to make the diagnosis. We'll take care of that. When you come in, we'll let you know if you have gum disease. But you know if you have bleeding gums. You know as if you see the root of your tooth. The root doesn't look like your tooth. It's a different color. It's a different shape. It's a different texture. If you've got root that's exposed in your mouth, it's not supposed to be. Maybe you've got pain from that because the roots can be sensitive. And that's not something that you want to have either. But you've got things that if you take a minute and look in the mirror, even though you're not a dentist, you can use common sense and say, this doesn't look right, this doesn't seem right, this seems off, this seems wrong. Maybe you have a tooth that's getting a little loose. There's so little bone around it that it's actually loosening up. It's going to fall out, or it's going to have to be pulled out if you get an infection and gets all swollen and your jaw swells up on that side. It may be too late to get a root canal to save a tooth. Perhaps not, but even that can lead to gum disease. There's so many things going on that if you see something, you come in, we take a look at it, and what we can do is we can stop the process. We don't have to sit by and watch you lose your teeth, watch you have to have everything come out of your mouth, and have you turn into your Aunt Sally, who walks around without her teeth in her mouth because she had gum disease when she was 26 years old, and when she was 26, the dentist said, you got to pull all your teeth. We have different methods that we can use to save your teeth. The first and easiest method of saving your teeth, once we diagnose and acknowledge and say that you do have gum disease, is to do a thorough cleaning. After that thorough cleaning is done, you may have enough gum disease that we need to use antibiotics, because we don't want that bacteria going to your heart and going to your liver and going to your brain and going to your lungs and all these other places where bacteria can go once they get into your blood system. Your immune system is going to be down. You won't be able to fight infection. We don't want you getting sick. We don't want you having those problems, having difficulty breathing and eating and keeping your nutrition up and being healthy. We want you to be healthy. So we can put you on antibiotics. Now there's two ways to do that. We give you the antibiotic pill and it goes into your blood system and kills any bacteria that have splashed out of your gums and gotten into your bloodstream. So we can do that. That's a simple process. A little more complicated process is we have an antibiotic, little granules that we can actually place under the gum in between your teeth. Now, how do we know where to put them under the gum? How do we know where to put them between your teeth? Well, it's a very simple process. We know no matter who you are, no matter where you live, no matter where you come from, no matter whether you're a man or a woman, whether you're young or you're old, if we measure under your gums 1 millimeter, 2 millimeters, or 3 millimeters, your mouth is within a healthy environment. And cleaning your teeth and perhaps putting you on some antibiotics that you take as pills is all you need. And then come in on a regular basis and we'll continue taking good care of you. And we'll continue that so that you don't have bleeding gums and it doesn't get worse. Now, maybe we measure and we measure a 4 millimeter pocket under the gum. Perhaps we measure a 5 millimeter pocket under the gum. At that point, what we want to do is we want to put antibiotics locally under the gum. We place it in there, and that helps kill the bacteria that's getting in while you're eating. It's out of the way, and that allows some healing in the gums, and that is a very good thing to do. Now, a lot of people don't realize this, but that's covered by not only dental insurance, but it's covered by your medical insurance because that's an antibiotic. So people that don't have dental insurance, a lot of people have medical insurance. And they don't realize if they come to the dentist that the medical insurance will pay for that antibiotic therapy. So it's not even going to be costing anything but your time and your effort and your desire to want to be healthy. Now, if you're at the point where when we measure a 6 or a 7 or maybe even a 9, now maybe that much bone loss, your teeth might be loose. Perhaps not. Perhaps they're still good. So we may not want to say that that tooth has to be pulled out. But if we leave it alone and we do nothing, picture this. Take a rock and throw it into a pond of water. And a lot of us did this when we were kids, I'm sure. Throw that rock in, and when it hits the water, you get a little wave that comes out. And that wave slowly spreads bigger and bigger and bigger and bigger. Well, picture that tooth that has a 9 millimeter pocket under the gum. So now you've got a space that goes down 9 millimeters. So you've got bacteria living down in there. They're going to start spreading through the gums to the other teeth. And it's kind of like if you had if you ever went to the store and got a whole bunch of strawberries and you just weren't in the mood to eat them today, but you went ahead and you washed them, you had some water on them, you put them in the refrigerator, and 2 days later you look in there and one of them's got a little bit of a smudgy thing on it. You know, it's getting a little cruddy because something's growing on it. You say, oh, you know what, I'm going to have them tonight after dinner. That'll be my dessert. And you leave it in there and you forget that you had them there. Instead, you went out for yogurt or something, you know. The next day you decide you're going to have it. You go into the refrigerator, you open it up, and now not only is that one kind of gray and hairy and mossy looking from the mold that's growing on it, but the one on either side of them is like that, and the one underneath it is like that, and now a half of that package has to be thrown away. Now maybe you went away for 2 days, now you're back, it's 4 days later, you didn't throw it away, now you open up and the whole thing's a mess. Well, that's what's going to happen to your gums with that deep pocket. So we want to do something with that. And the first thing we want to do is use an antibiotic to clear out any infection. After that, there's certain treatments that we can do that can make that area, if not healthy, at least stable. Stable means it's not going to affect the other teeth, and as long as it's not causing you pain, you can leave it there. But there may be some things that need to be done. And one of those things is laser treatment. And I say laser treatment because a lot of people say, oh, I know what comes next. You go to the specialist and he cuts your gums. Well, yes and no. Those days are almost gone. There are people and there are teeth that need to be seen by the specialist, but the general dentist, people like myself, can still see and take care of people that have pockets under the gum that are 7, 8, 9 millimeters, as long as they're healthy and not bleeding. And the laser, non-surgical laser treatment can be done to do that for the teeth, to keep them healthy. So we have more videos. Check out the one on lasers. You'll love to hear the fact that you don't have to go and have surgery done necessarily on a tooth. You can have laser treatment. I'm Dr. David Shannon. I'm in Northridge. We're in the 21st century. Your dentistry should be in the 21st century as well, because modern is where the answers are in today's world of technology. So we want you to be smiling, we want you to be healthy, we want you to be happy, and we want you to be that way as soon as possible. So give us a call, check out my other videos, especially the one on lasers, and we'll see you soon.